Good afternoon. I'm very pleased to introduce a topic now that is close to everybody's heart today, I think, and which is going to be presented by the person on the left of me. I'm going to ask you, Janika, to introduce yourself and then just give us an overview of what you wanted to speak about today, after which we will continue with some questions. Is that okay?
Yes, thank you. I'm coming from Tartu, Estonia, and I'm working as a professor of neurology in Tartu University and also stroke neurologist in Tartu University Hospital. And the topic, today's topic was proposed by the neuroepidemiology panel, and it was how big data can help to organize neurological services. And the topic was about big data, which is quite unfamiliar to in healthcare, because nowadays there is a huge amount of data coming in, but there is a gap between healthcare and outcome, and somehow the big data or the knowledge coming from big data is not yet going into our knowledge and our management of patients, and somehow these resources are wasted, and we need more effective use of the data. There are several types of data included in the big data. They are administrative data, clinical registries, all biomarkers, and imaging data, and also patient-reported outcome data. And these need to be combined and to be used for improving our management. But unfortunately, as I said, this is we are in the beginning yet with this, and actually there is no data in the literature to find how these data can help us, and is it cost effective, and there is no evidence for that. And that's why we need joining of the data, but also one field is also very important. It is the analyzing the data, and this needs bioinformatics and to get the most of the data. And finally, I should say that big data is not resulting in good data. It means that the original data must be good. So that was the main idea of my presentation.
Yeah, so that's very clear. So as I have always understood big data, this is all about data sets which are too large or too complex to be dealt with by the traditional data processing software. Yes. Is that a correct definition, more or less?
Yes, this is a correct definition, and mostly from other fields, big data are unstructured data. And that's why data mining and so on are used for that. But in medicine, they are, how to say, semi-structured, and there are protocols and a lot of structured data as well, including clinical registries. These are structured data.
And you just mentioned that there is a big gap between healthcare and the outcomes. Now, has this also, are you aware, let me put it that way, that because I could imagine big data might lead to false discoveries almost. Are you aware of any example in this area?
You mean false?
A discovery rate, let's put it that way.
So, implementation, this morning we had also a presentation about implementation. And implementation of knowledge which we get from research is somehow not so good.
Well,
we should say. And this is the problem we have to solve, and first we have to prove how to improve the big data so that we can get most of it. So,
so this is really a fascinating topic that
yes,
you're studying.
This is a fascinating topic, and I think that patients and also health care professionals must be educated about that.
Yeah. I have one last question, since you mentioned patients within this context. At this moment, within the neurological constituency that we work in, we are working on a registry in the field of neurology and with active patient input. How would you see that from your point of view and with your enormous knowledge of big data?
I think this is really very important, because the outcome which we want to get from management of patients in clinical practice, this is the well-being of patients and that they improve. So we need data to know how our management and our treatment works. So this is the main idea actually, and this helps us to reduce costs as well. Maybe something is wrong in our management.
So, well, that is a very encouraging answer. I'm going to leave it at here. Oh, sorry, there is a question. I do apologize. I hadn't seen you. Please go ahead.
I have a comment and also a question. It's kind of also in basic research with the new technologies. We have a lot of huge data, and I think the problem is you always find something in this huge data, but the question is how you really can interpret this data, because if you have such different genomes or gene identification, so there's always something. And I think you have to be aware of that, the differentiation and the processing of itself has to be do correctly and also to prove the data. I think this is really important. And the other aspect is, I think maybe in the clinical practice, what do you think about artificial intelligence? Because you can find it everywhere. So especially maybe scans or radiology data, or also writing a letter, or maybe put data together from different analysis. What do you think about what's coming up with the artificial intelligence for the next years and helping maybe the medical doctors to improve to these big data sets, also that improves the results for the patients, what's helping them? Maybe it's getting faster, it's getting better, no bias anymore from the medical doctors. What do you think?
Thank you for that question. I think that the final result should be that it improves healthcare and management and improves the outcome. But actually, I should say that there is no evidence yet that big data can help us, and this needs to be proved. And as I mentioned already, also the data must be validated and cleaned and to be used in clinical practice. Artificial intelligence is is used in many fields, and as I know from my practice in imaging, and it helps us. But I know also that there are errors in it, and we have to be very careful not to take it as a real results or answers.
Okay, thank you, Professor Korv. Please join me in thanking Professor Korv for this